to be here with my compadre and my partner in, trying to be an advocate. I wish there were more members here, or hopefully they will be listening, and other members from across the aisle. But, it's very important that we know that the protective issues for children and seniors and people with disabilities are all the same. They're just at different points in the age spectrum, or different points in the ability to care for themselves. And so we're all in this together. I'm just delighted to hear and see all of you. I know that we're all sitting at a point in time in California. We used to be on the cutting edge, and now we're only cutting. And we have to join our voices together and make them heard at the highest levels, not only of our state government, but of our federal government. So I just want to thank all of you for your very important work and testimony, and certainly, again, thank Ms. Mitchell for her leadership and the staff for all the work they did to put today together. Thank you.
Thank you, Ms. Yamada. With that, we're going to open it up to public comment. It's about 5 after 4. We were published to go to, I believe, 4:30. And so the mics, I think the mic is live to my left. I'll ask I have the clock, the infamous clock, and I'm going to ask, I'd like folks to line up, just because we're able to go a little faster clip. I'd like member for public, yes, sir, thank you. Just because we can spend all of our time hearing your comment versus chair changing. Seeing the number of people who are going to testify, I'd like you all to keep your comments to 2 minutes. Thank you very much for your participation, and we'll start with our first public comment.
Randy Hicks of California's Disability Rights. Is this thing on? It is on. Okay. Now, I was concerned about some things here. One of the things I was concerned about is the fact that the governor's budget will not reflect anything that the Subcommittee does. Mm-hmm. That concerns me in 2 ways. One, it turns out that we're not going to have a really balanced budget, because of the fact is he may present a balanced budget, but anything that the Subcommittee does will end up being in more cuts in the May revision, which we're all going to lose out on. The second point I would like to bring up is advocates, we're wonderful people. We thank them all. But they're not the ones who have to go and get that check in the mail. They're not the ones, unfortunately, who are the ones who are going to say, first, the Schwarzenegger administration reduced the state share to Social Security. That was one of the first things they did. Second thing they did was they cut the medical optional benefit. You remember that they were talking about not getting dental care? I haven't had dental care in almost a year now since they eliminated that benefit. Mm. You can't get it through Kaiser. You can't get it through an HMO. The other thing is that they are also kind of setting this up that when they got rid of the optional benefit, I'm going to go on with this, that they also decided to, the co-pays. The co-pays are going to kill us all, literally and figuratively, because what they got planned is they're going to be $5 co-pays for medicine, and people ain't going to have $5 co-pays for medicine, and they're going to have the cap.
30 seconds.
Okay. And the other thing is, it's the emergency room benefit that I'm very concerned about. So when anything the federal government's going to do, it's going to resound to the state. Is the state going to be ready? Is the county going to be ready? That's the question we're all going to have. And as a disabled person, I'm not ready.
Thank you.
Thank you, members of the committee and Madam Chair. I'm Tim Race, Executive Director of the Community Action State Association, representing 56 community action agencies in your local community, providing services to 3.2 million Californians. We're in support of all of the testimony of the panelists today, and we're in complete opposition to any reduction in federal services and support for low-income people in California through social service reductions. We need to fight this because those effects would be devastating. Thank you.
Thank you.
Good afternoon. My name is Ronald Coleman on behalf of the California Immigrant Policy Center, and I just want to thank you very much for holding this hearing on how our state, and most importantly our state's families, will be affected by the decisions or indecision of the Subcommittee over the next month. We do think that The Supercommittee needs to be very cautious in how it intends to reduce the federal deficit. We definitely agree with all of the comments from the earlier panels. Making deep spending cuts to core programs and services to so many families that California relies on during a time of such economic uncertainty is definitely not the answer. And as we heard earlier with the opening statement from Assemblymember Mitchell, that based on census data from 2010, 6 million Californians are below the poverty level, and this is 16% of our population. This has a disproportionate impact on immigrant families as well. We do not believe that our federal policymakers should take any action that essentially increases poverty rates or further diminishes programs and services available to those that are impoverished. We would encourage our state officials to push the Supercommittee and federal officials to stop the shifting of costs to our state and to find revenue solutions that do provide services for these indigent populations. Thank you.
Thank you.
Good afternoon. My name is Karen Farley with the California WIC Association, and we appreciate the opportunity for public comment. I think Ms. Ross and Mr. Parks did a great job of pointing out the vulnerability of WIC, but I just wanted to underscore that as compared to some other nutrition programs, WIC is vulnerable, so please advocate for us in DC to keep us whole. And they'll also point out that cuts to WIC have broader reach in the community. So WIC provides fruits and vegetables in the food package, which, in addition to keeping families healthy, supports the agricultural industry, it supports the grocery industry. Our food budget here is a little under $1 billion, and that's a really good boost to the grocery economy here. And then it supports the marketing industry. The WIC food checks have to be, or the banking industry, the food checks have to be processed. So it affects a lot of people in the community who use WIC as, part of the subsidy for their jobs and funding for their jobs. So the cuts to WIC not only impact the 1.45 million participants each month, it affects others in the community. So please help us protect WIC and keep it whole. Thank you.
Thank you. Next witness.
Good afternoon, Jonathan Tran with the Southeast Asia Resource Action Center. I'm here to speak on behalf of the 900,000 Southeast Asian Americans that are currently living here in California. Thank you so much for having this very important discussion. I just wanted to point out one fact in the sense that the impact of the majority of these cuts will actually exacerbate issues of poverty in areas that are already suffering. So, for example, in areas of the Central Valley where unemployment rates are 16 to 18%, these are areas where the impacts will be felt the most. The irony of this entire discussion is the fact that in these very same areas are also the places where you'll find the loudest voices for further cuts. So as we have these policy discussions in this very important context, let's not forget the fact that there's still a lot of individuals that we need to win the hearts and minds of. So on behalf of CRAC itself, if folks want to take this show and move it south to communicate in districts, especially for representatives that aren't here in the room, we're more than willing to be there to have that discussions in areas that these discussions need to be taking place in. So thank you.
Very good point. We appreciate the offer. Next witness.
Good afternoon. Thank you for this opportunity for public comment. My name is Addie Myers. I'm with UDW, who represents 65,000 IHSS providers throughout California. We'd like to take this time to highlight prospective job loss resulting from some of the federal deficit reduction proposals. While it's important to discuss the impacts on services, we believe it's equally important to address potential impacts on employment and business activity. As the chair mentioned earlier, even, for example, a 5% reduction in Medicaid spending can result in an estimated 28,000 potential jobs lost and $3.7 billion in lost potential business activity. We all need to acknowledge the fact that federal stimulus spending on Medicaid is a powerful economic stimulus in California. Thank you.
Thank you. Next witness.
Madam Chair, Assemblymember Yamada, good to see you again. My name is Chris Jensen, and I'm here on behalf of Resources for Independent Living. We're an independent living center that provides services to people with disabilities and low income in Sacramento and Yolo counties. And over the last few years, we've seen our numbers increase. There's a greater need than ever before. One of the unintended consequences of the 2008 economic collapse in the United States was a rise in disability claims. That number is growing. When jobs disappear and unemployment benefits run out, people with disabilities who may have worked and never filed a claim before filed claims. So there's a greater need than ever, and what we really need are jobs. I think we have a tsunami heading our way, and we don't know how high the wave is. We don't know how much destruction is going to be coming our way. We just have no way of knowing, and I think it is really important for the state legislature and the governor's office to be ready to act as soon as and quickly as possible. If they need to have certain pieces in place so that you can respond quickly and maybe cut some red tape bureaucratic procedure to respond to whatever's going to come out of the Supercommittee or the Congress, that we can do. So we're in full support of both panels and what everything they had to say, and we hope that this isn't just preaching to the choir. Thank you.
Thank you. Next witness.
Good afternoon. My name is Tim Shaddix. I'm with the California Association of Food Banks, and we represent 41 food banks throughout the state. And in every part of the state, we've seen a very dramatic increase in need over the past few years. Some have said that this past few months have actually been the worst so far. We really, the need is probably going to continue to be high as unemployment remains high. And we are not able to meet this need at all without substantial support from federal nutrition programs, specifically TFAP, the Emergency Food Assistance Program, and the Commodity Supplemental Food Program. Without those programs, if we saw any cuts to those from the Supercommittee, we would probably have to start making some difficult choices about cutting back services or not being able to provide for everyone who comes to our food banks and the pantries that we provide food to. And as important as those programs are, we also know in our communities that we serve that the SNAP or food stamp program is the first line of defense against hunger. And any cuts or restructuring to that program or any of the other safety net programs that were discussed today would mean that we would see far more people at our doors needing assistance, and we would not be able to meet that need. So we want to say today that people sometimes say that charity can make up the gap if we cut the social safety net, but it was very clear to us that we would not be able to meet that gap. And so we strongly agree with all the panelists today that we need to protect the social safety net and find new revenues to reduce the needs for cuts. Thank you.
Thank you very much.
Chatso, Latino Coalition for Healthy California. As we know that Latino population in California is about 40%, and our population cuts across every one of the program areas discussed today. We are children, we're elderly, we participate in programs up to 50%, almost up to 60% in healthy families. So many of the programs, that would be affected by the prospective cuts, either sequestration or the current cuts that may be entertained by the Supercommittee, are going to be devastating to our population. And so we as well support a very balanced approach, and that revenues need to be on the table to help maintain the services that our population, for one, really relies on. And so therefore we're also in support of the comments made by the California Immigration Policy Center too. So thank you very much.
Thank you. Next witness.
Thank you, Carolyn Jenna with the California Medical Association. Wanted to thank the committee, and thank you, Assemblywoman Yamada, as well, for being here today, just to really highlight the gravity and immediacy of the situation and the impacts that these proposed cuts or discussions that are being had at the federal level can have on California's underserved. The physician community is extremely concerned. We have to add these onto the proposals that were passed just this year. In California, cuts to Medi-Cal are huge and have not yet been able to be justified by the state. We think it's telling that the state plan amendment that the state submitted for the rate cuts for this year, for the 2011, the 10% across the board, the 90-day clock on that just ran out yesterday, and last night CMS requested additional information from the state to verify that it would not impact access. We obviously believe access here is severely limited, is in no way on par with the federal statutory requirements. California is 47th in the nation for the rates it pays physicians to treat these people. And with the bad economy and increasing unemployment, more and more outside of health reform implementation, more and more of them are going to be on these programs. And these are just people that we cannot leave behind. And so again, thank you for having this hearing to really, make this clear, make everybody aware that this is something that's happening right now. And we all need to be a part of it and try to stop it so it doesn't hurt the neediest Californians. Thank you.
Thank you very much. Appreciate all of the public members who also added to this rich dialogue by providing your perspective. At the onset of the hearing, we talked a little bit about, our overall goals, and I think the value of interim hearings is it gives us an opportunity to have rich dialogue. We're not trying to respond right then to budget votes or bills, and it creates a learning opportunity, I think, for us as policymakers to hear from those of you who run programs, who live programs every day, who represent populations who are impacted by these cuts, and for us to hear and learn from you. So I think on the overhead now, we've got a list of some of the recommendations for the super committee that we heard. I think that really at the 10,000-foot level reflect most of what we've heard from panelists today. Again, to protect children and the most vulnerable from bearing a disproportionate burden for the deficit, to foster economic recovery and jobs until our recovery is stable and unemployment is decreasing, or we risk deepening the deficit in the long term. State and local government cannot absorb additional costs. Increase revenue significantly, particularly from those that can best afford to pay, and avoid further burdening those who cannot. And to make smart reforms, not wholesale cuts to our health and human service programs. From my perspective, I think it's very clear that government exists because it has an indispensable role to play. We should be moving to strengthen our social safety net, educate and foster opportunity for all our children, ensure the public safety, protect the environment, and partner to create and maintain jobs. I didn't run for public office and come to Sacramento to engage in wholesale program cuts or trying to minimize the size of government. That wasn't what brought me here, nor do I think was that the perspective of those who elected me. I think ultimately Americans value work and being able to get it and access it. Avoiding taxation has never really been a part of the overarching value of our people or their policymakers' charge. I think we as a legislature have a fundamental right and responsibility to communicate with our congressional delegation what matters to us and to work to hold them accountable for heeding our voices. I'd like to thank Assemblywoman Yamada. I'd certainly like to thank the Budget Committee staff, both the Republican caucus and Democratic caucus, Nancy Stroll from my office for working really hard to pull together a very informative, rich discussion about this critical issue facing all of us as Californians. We'd like to thank all of you for participating and hope that you will continue to stay engaged and reach out, as many of you have already expressed today, to our congressional delegations and to members of the Super Committee to really make sure they understand if they sneeze in D.C., California will catch pneumonia, and we can't afford to continue to jeopardize the core infrastructure of our core safety net as a state. Thank you so much for your participation. The hearing is adjourned.